Hello, everyone. Welcome to our Expand Exploratory Studies pre-proposal webinar briefing. We'd like to welcome you to our meeting today to be able to discuss details about the solicitation. My name is Jimmy Wu. I'm the TRISH Deputy Director and Chief Engineer. I'll be joined by Dr. Rihanna Bokhari, who is our TRISH Scientific Research Director, and Guillaume Rignot, who will support us and talk about the Do Anonymous peer review later on in the slide deck. So with that, let's go ahead and get started so that we can get to your questions later. So here's our agenda. What we want to go through is TRISH, if those of you are not familiar with us, and our mission and what does TRISH fund, the initiative that we're talking about here with regards to our EXPAND program and the solicitation that will be supported as part of our exploratory studies. Some frequently asked questions are dual anonymous peer review, or DAPR. If you to go over details of that, this will be one of our first solicitations using this peer review methodology, and then hopefully get into a number of your questions towards the end of the hour. So let's get started here. First, for those of you who are not familiar with TRISH, we are the Translational Research Institute for Space Health, and we are a cooperative agreement with NASA's Human Research Program to relentlessly seek and support high-impact scientific, technical, and psychological advances that will help any human explore space safely. And what we do is complement NASA's efforts with by taking an approach that is much more risk tolerant, much more disruptive, and step function type of improvements over the more methodical approaches that NASA takes to their research program. I work for Baylor College of Medicine, and we are the lead institute for this consortium that supports TRISH, along with MIT and Caltech, so that we have a three-coast approach to addressing the risk to human spaceflight and supporting NASA's Human Research Program's mission. Now to the EXPAND program itself. Now, this program came about, as I mentioned earlier, with what TRISH did to support the early commercial spaceflight programs. So this involved initially the Inspiration 4 mission that the SpaceX launched back in 2021. Because, as I mentioned earlier, TRISH is an institute that does take some risks. We looked at trying to see if that platform for human research can be used to conduct viable human research. And we found it to be successful, and from there we developed this program that will today come to a point where we are able to provide a procurement mechanism to support research on those commercial spaceflight platforms. And so that's really the first part of it, is that. And then from that, we have a set of studies that we have then standardized to allow for a continuous set of studies and protocols that can be used from mission to mission, even across different launch providers as well, given that, as we know, the various launch providers have different missions they do for their customers. And so we're trying to come up a way with standardizing that approach overall. As I mentioned earlier, we have validated this platform as a real good fit for doing human research. And it has its advantages because it allows for a high throughput of diverse participants to come through, and it includes a cohort of perhaps international participation as well. And then we also have the infrastructure in place to allow for a simplified broad consent, by which if your project is selected to join us, you will be have an opportunity to join this community and be part of our broad consent to simplify how we would enroll customers to participate in your study. And then secondarily, we'll talk about this a little bit more detail, how the data and all of the samples that are collected within EXPAND can be shared with the scientific community while maintaining strong privacy and safety mechanisms for the subjects who consent to participate. So this is a really nice diagram to kind of show what we do with EXPAND with regards over on the left side, all the various launch providers that TRISH and Baylor College of Medicine have started engaging with. Some of these organizations we have actually, as you probably see through the news, are actually flying humans in space, and we have relationships with them to make our science available to them, so that the customers may, through a customer service, customer engagement experience perspective, have the opportunity to do science during their space flight. And so we support providing that science to them and be able to work with the launch providers to have access to the passengers, and then to be able to collect the data, and then have all of that funnel into what's in the middle here, sort of our, it's not a black box per se, it's a black circle of how this data comes into EXPAND. And then with EXPAND, we do the data management. We get it stored in such a way that then it can be distributed outwards towards the right side of this chart, where the various stakeholders, such as the launch providers themselves, may want to see the data back from their customers. Various space agencies may want access to to some of this data as well to help further enrich in their data set with regards to human research. Any practitioner like the flight surgeon community may want access to it. And then I think also the research community at large, right? So it's not just the investigators that are part of Expand, but also researchers that are third party, extramural, or even in the future, folks that want to come in and do retrospective studies. They will have an opportunity to make data and sample requests from Expand so that they can get access to those resources. So we're really excited about being able to set up this program. Considering that commercial spaceflight is really just now emerging and as we know, becoming more and more successful. So we want to be able to have this resource available to not just the launch companies, not just to the private individuals themselves, but to all these various stakeholders you see on this various chart. And we obviously are very excited to have a new class of studies through this solicitation be able to join the Expand program. So one key thing I want to highlight is for those of you that have done NASA missions before or even not familiar with doing human research in spaceflight, there are some differences between how these missions are set up between the commercial entities, right? So like I said, this is the private missions that SpaceX, Axiom, Blue Origin, and others may be doing versus NASA or even other governmental agencies like ESA, CSA, et cetera. And so hopefully this chart will help you understand those key differences, and we'll go into, and this maybe help you understand kind of the nuances of what we had written into the solicitation itself with regards to operational constraints and whatnot in terms of what we know versus what we don't know, and how you can best prepare your proposal to be able to be flown aboard these missions. And so really the first row here, relevant hazards, the first three are really still applicable for commercial spaceflight, whereas, the radiation exposure and distance from Earth are still, they're a little bit not as relevant because the commercial missions right now are still within low Earth orbit. So both the radiation and the distance from Earth hazard are a little less negligible, a little less relevant. Demographics are slightly different. As you know, with commercial spaceflight, we now have access to the general population, typically a one-time experience where they're not worried about a professional astronaut needing to wanting to be able to have multiple spaceflight missions to support their government programs. And so it's a little bit different type of motivation on the demographic, on the subject side in terms of what they are willing to participate in, because they may be willing to do some studies that may, for a professional astronaut, might screen them out from a future mission. So there is some difference there in terms of the types of studies that a private astronaut may want to do. Whereas on the NASA side, the cohort's a little bit different because these are highly screened, high-performing career astronauts, usually the most healthiest individuals as well, with different types of motivations to maintain a high level of health and performance in order to stay flight worthy for future missions. The mission durations are obviously very different as well. Commercial spaceflight missions, we list here under 30 days, and then that's really more of a just a kind of an upper ceiling. But the missions, and you'll probably see this within the solicitation themselves, are going to range anywhere from 3 to 10 days. So 30 days is going to be the most extreme, but either way, it's still much shorter comparison to the missions that NASA has, which are typically half to full year, and for ISS, and then for the Artemis missions, it's going to be a different type of paradigm for those missions as NASA shifts to returning back to the moon. In terms of frequency into spaceflight, we are looking at around 6 individuals going into space, typically with the orbital missions here per year. Whereas on NASA, it's a little bit different in terms of the number of individuals that are available to participate in these studies. And then training, I think this is probably the biggest thing that you folks in the audience should be fully aware of is with the commercial astronauts, they are part-time participating in training. It's not their full-time job. They have day jobs that they have to commit to. And so their availability to do any training is much, much more limited than NASA astronauts, folks in the astronaut corps, because those are professional astronauts and their time is dedicated to being able to do research. So that's one thing to keep in mind. If you've got a study that requires a significant amount of training in order for them to do on their own, that might be a hindrance or constraint with regards to your study. So please keep that in mind with regards to your requirements for how to best collect data, especially in-flight data collections. All right, so let's move on here. And so I just want to kind of give an idea of sort of the menu approach we did within Expand. I mentioned a bit earlier, a couple of slides ago, with regards to kind of a standardized approach to some studies, and that's essentially what the essentials box is over on the left. This is our essential measures, where we have a known set of studies that we make available from mission to mission and launch provider to launch provider in order to try to standardize a core set of physiological and biosamples to be collected. And I actually go over these with I think the next slide. And then what we're looking for with our exploratory studies, which is part of this RFP that you're here listening to, is now the middle and the right, where you're talking about benchmarking and expeditionary, and where these are studies that are looking at, I think they're kind of nicely arranged with the two topics that we have. One is with the benchmarking is we know whatever your data you're collecting is known to be useful for health and performance in spaceflight. And what we're trying to do with benchmarking is to optimize the collection of that data. So whether it's improving the technology, improving the training, we're trying to optimize the cost, and the cost here is not monetary cost, it's the cost in sending it into space up mass. It's the volume, it's the amount of space it takes within the vehicle itself, it's the amount of crew time, as I've been talking about earlier with with the previous slides. It's optimizing how much resource it takes to collect that data or collect that sample. And so we're trying to optimize that with the benchmarking bucket. And then the expeditionary one on the right is now looking at studies that we don't even quite know. It hasn't been validated that this data set is useful for spaceflight, right? And so it's the continue to drive some sort of hypothesis-driven research to say, hey, I'm going to collect this. I'm going to try to prove that this particular marker or this particular activity or this particular technology provides some sort of data set or some sort of sample that's useful, that we can do something actionable with it, right? So that still needs to be proven. So hopefully you'll see with our solicitation the various topics, and Dr. Bokhari will kind of go over those with her part of the slide deck to kind of elucidate the two. But what we're looking for with our exploratory studies is research studies in these two buckets, whereas the essential ones on the left are already optimized. I'm just going to go over those now with this next slide, where we've got a suite of studies here, our essential measures, as I've referred to earlier, where we're looking at sensory motor adaptation. I'm going to start over here on the left, sensory motor adaptation, to try to see how we can best study this and understand space motion sickness to help reduce the risk of that in spaceflight. And then as I move towards the right, we're looking at cognitive performance as well, with a standard set of 10 tests as part of the cognition battery. And then paired with that is biometric monitoring and also actigraphy, where we collect it off smart sensors or a smartwatch platform. And those data sets are can be made and done, collected while you're performing your study as well. So you don't have to necessarily duplicate that data collection. We have that available right now, and we can have it where we can work with the commercial launch companies and the subjects to have this being collected while you're doing your study as well. So that's a benefit of kind of what we're doing with essential measures, is all these studies can now be sort of cross-compared, and a collaboration can occur with merging these data sets so that they can be done together. And that also pointing to the advantage of us, how we do this under one broad consent. All these data sets can be shared from PI to PI so that you do not need to reconsent subjects. In the middle here, we have our biosample collection and banking, where we collect 5 different sample types: blood, saliva, urine, stool, and skin swabs, which then perform the various analysis and assays that are listed below it, whether it's genomic or omic or microbiome analysis. This is what this particular study does. And then the extra samples that we collect, we actually store long-term as well. We aliquot it and store it so that it can be requested by future researchers. We also do a SAN surveillance protocol, which basically mimics NASA's Med-B 1.10 protocol as well, but we do not do the MRI and eye ultrasound. But the other aspects of the study, the other imaging and testing that we do is part of SAN surveillance. So we obviously encourage our subjects to be able to participate in that. We also do radiation monitoring as well, looking at active radiation monitoring that allows for per minute dose data and also LAT spectra data. And there's also a wearable personal dosimeter to be able to collect cumulative dose as well. And lastly, we have a suite of questionnaires, surveys to be able to collect subjective data that that's implemented by our database provider, TrialX. And so they have a standard set of widgets that are applied onto a survey platform. And should a part of your study want to do surveys or some sort of subjective data collection, we would actually have you work with TrialX to get that implemented on their platform. And then once the data is collected and the device that collects the data is online, that data automatically goes into our Expand database for automatic ingestion. So with that, I'd like to hand it off to Dr. Rihanna Bokhari, who will continue on with the rest of our presentation. Thank you.
Thank you so much, Mr. Wu. So for everyone, I'm going to talk about some of the details of the solicitation itself. So this solicitation was released on March 4th. Step 1 proposals are due April 16th. And then if you are selected to go forward to Step 2 proposals will be due July 2nd. We estimate that we will select some proposals by November 2025, and we anticipate the earliest start date would be then also November 2025. So this notice of funding is looking for projects that are focused on implementation in commercial spaceflight. And so each of these projects would go through 2 consecutive phases, and I'm going to talk about what that means in a little bit. So first, I want to talk about the different types of flights that are included in this solicitation. So these are in the flight details. So essentially, there are 2 different kinds of flights that we have access to through our partnerships. The first is orbital free flyer missions. These are usually about 3 days and nominal. They can go up to 5 days. And we anticipate that there could be about 2 flights per year, 2 flights that occur within the period of the grant, and that's kind of at a minimum. Then there's also private astronaut missions or PAM missions that go to the International Space Station. And these missions dock with the International Space Station, and they're about approximately 10 days in duration. And we, again, anticipate that there's going to be about 2 in the period of performance of this grant. And so these details are really important for understanding the kinds of studies that you can propose, and I'm going to talk about that in a second. So there are 3 different study formats that we anticipate folks will use. The first is to collect data pre and post flight, and this gives you access to the largest population of potential flyers. So you can collect data on both orbital and free flyer PAM missions to the ISS. So pre-post data collection that happens all on the ground and not in space, and that allows for the most potential subject number. In-flight free flyer missions only. So for in-flight data collection, we can only do that on free flyer missions, on only orbital free flyer missions. And like I said, these don't dock with the International Space Station, and those happen, we expect about 2 per the grant period. And so for example, this is something like Inspiration 4 or Polaris Dawn are examples that have flown previously of an orbital mission that's not docking with the International Space Station, just to give you an example. So the third type of format is an in-flight study, but that is done during undocked operations. So data collection that does not require any kind of hardware. So this would be for a survey only or some sort of software, something that doesn't require hardware. It can be done on an orbital mission that in the undocked phase, so before it gets to the International Space Station and docks, or after it leaves the International Space Station and undocks. And this is essentially because there's additional requirements and additional steps that are needed to do active work on the International Space Station that don't fit the timeline of this solicitation work. All right, so the first topic of this solicitation is focused on new hypothesis-driven studies. So the hope is with these studies to enable successful human space travel. It's important to consider that these studies should come with significant ground-based preliminary data to justify the use of spaceflight. So if you shouldn't be trying something out for the very first time in space. We need to have significant preliminary data to justify the use of spaceflight. These should be simple study designs that are very clear with an uncomplicated question. So this goes to Mr. Wu's discussion about limited time in prep for the commercial spaceflight participants, and the fact that they're only really up there for a few days. And so we have to make these studies simple, straightforward, and easy for them to execute. So the reason to explain an uncomplicated question, so it should be straightforward, simple to do, and a question that is answerable in this short amount of time. Proposers must define the number of individuals that are needed for the study. So make sure that you're backing that information up with justifications and effect sizes and robust statistical planning. So we're not interested in flying studies that cannot achieve any kind of relevant significant data with the small numbers that we expect. So we're looking for some indication that you have addressed that concern and are realistic about the number of individuals you might be able to actually collect data on. Of course, there is possibility that we have more missions than we expect, but we don't want you to assume that we will have more missions. So we are taking a conservative view on that. I'm not going to go into detail on the subtopics, but you're more than welcome to ask questions about them. The subtopics you can look at them in the solicitation because we are a little short on time today. So topic 2, this is focused on technology demonstrations. So these are demonstrations of new technologies that would benefit from that demonstration in spaceflight. So this technology should have significant preliminary data on the ground. So it shouldn't be a new technology you're trying for the very first time only in spaceflight. So it's a useful, beneficial technology on ground. Let's see if it works in space. That's what a technology demonstration is. To determine if it's viable in space. There are many things that may or may not actually work in a space context. So it's important to justify that in your proposal. Again, the subtopics I will not go into in detail, but you're more than welcome to ask questions about them, either in this forum or after the fact. So there are a few unique considerations that you need to think about for commercial spaceflight research. Time constraints prior to the flight and as well during the flight are very extreme. So you don't normally have a lot of lead time, and there's usually a lot of time constraints in terms of subject availability prior to the flight. There is, like I said, little to no opportunity for actual crew training. So you need to be able to provide very clear instructions, very clear and straightforward projects. Operational constraints that exist and are worth noting are that there's not a traditional laboratory setup. So on the International Space Station, most folks are familiar with the fact that it is essentially a laboratory, and there are laboratory tools and devices, and it is more like an actual laboratory. On especially orbital missions and in the context that we are talking about, there's no real traditional laboratory setup. So you have to bring everything that you will need for that study. There's also limited and unconventional crew cabin volume. And this is not something we can give specifics on, but it's just important to note that the crew cabin is very small. And any type of project needs to take into consideration that there is very limited space within the cabin to actually do a lot of activities. And we will answer whatever questions we can about this. We do not have specifics on the cabin size and dimensions because that's just unavailable to us. So award information, both award types are relatively similar. There's a few notable differences to bring up. The award amount for topic 1 is $300,000, and that includes direct and indirect costs. So if your indirect costs are higher, that means you have less available for direct costs. So that's just, it's combined, it's total costs. Topic 2, the total amount is 200K instead of 300K. Both projects have the total time of 2 years, and that includes the flight definition and flight implementation phases. And I will talk about those on the next slides. And you have to give us a budget for each phase. So a budget for the flight definition phase and a budget for the flight implementation phase. And the budget doesn't have to be evenly divided amongst those 2 phases, and the years do not have to be evenly divided amongst those 2 phases. But the flight definition phase can go up to 1 year. For topic 1, your budget should be based on the number of subjects or flights you will support, essentially. Whereas topic 2, we are expecting you will support 1 flight. And one more thing to note is that the closer a project is to flight readiness, that the longer it will remain in the queue, and that therefore more likely to fly on an orbital flight or PAM mission. So the shorter that flight definition phase, the more likely it is to reach a mission. So if your flight definition phase was 1.5 years and you're hoping that 6 months is enough to catch a flight or 2, that may not be the case because flights get pushed and things happen. So the shorter your flight definition phase and the longer your flight implementation phase, the more likely you are to collect more data. And so TRISH is not making any requirements around that. That is up to the proposer, but we are just telling you the reality here. So the flight definition phase, it's important to note that flight opportunities are outside of TRISH's control. We cannot control when the various different flight companies will launch a flight, and that includes weather, that includes when their customers are interested in going, and many other issues. So TRISH does not control that. And so it's important that proposers build some level of flexibility into their flight operations and understand that that's just going to be the reality. So the flight definition includes all activities that are needed prior to flight, including purchasing materials and hardware and things like that. Your project should be flight ready when and able to manifest when the flight definition phase is done. This can be as much as 1 year, but it can't be more than 1 year, but it can be shorter. And all data sharing agreements will need to be signed and IRBs produced obtained during this flight definition phase. Okay, so the flight implementation phase, again, it's important to note that flight opportunities are outside of TRISH's control. So it is possible that you will be selected for flight definition phase and not able to proceed to flight implementation phase because no flight gets scheduled. And so that while there have been very consistent commercial space flights over the last several years, it is possible that paradigm could shift, and that would mean that there would be no flights available. So it's important to note that there is flexibility needed here. So flight implementation phase begins after a mission is announced that has a subject pool that has the opportunity to consent to the particular protocol. So this includes things like hardware certification or support for hardware certification. Hardware certification costs themselves are actually something that TRISH takes care of with our partners, so not something that you need to include in here. Training that TRISH or flight provider might need as far as personnel training, and then as well as any other data analysis that happens after the flight. It's important to note that this phase is not guaranteed. If there is no mission or subject pool that can consent to the protocol will not advance to the flight implementation phase. That doesn't mean that the flight definition phase was not successful. The flight definition phase could have been successful, and that could be kept in a queue for a spaceflight company to pick up at some point later if there is an appropriate population. But it will not advance to the flight implementation phase if there is not an appropriate flight and subject pool for that activity. So it's important to note that there's a few things that need to happen to be eligible to go from flight definition phase to flight implementation phase. The first thing is that you have to successfully complete the flight definition phase, and TRISH determines that. Have the project and hardware, if that's applicable, accepted by the flight provider. So if the flight provider does not accept the hardware or the project, then that will not advance to flight implementation phase, and those funds will not be awarded. You have to comply with all of TRISH's investigator requirements that are also listed in the solicitations. So you will be funded for the flight definition phase first, and then if you meet those requirements, then we will award the flight implementation phase part of the project. All right, so a few FAQs, and then we'll switch over to dual anonymous peer review conversations. So the first, the announcements of awards will be made in November of 2025. Can I request an extension for submitting my application? Extensions will not be given. Is there a required format for biosketches? NSF or NIH biosketch format is perfectly acceptable, but there is no requirement. Please note that there is a 2-page limit. Can I ask for answers to my questions in the solicitation document or FAQ? If I don't know, who do I ask for assistance? Please ensure before you ask a question that you've read the solicitation and the FAQ entirely before contacting TRISH with questions. But if you have a question, please send us the question to spacehealth-info@bcm.edu or to link the TRISH concierge, which just sends you to that same email account. Okay, can a non-US company apply for this opportunity? The solicitation is open to all US-based companies and institutions. For more information regarding the international participation, you can find that at this link here. Some of you may not be familiar with cost sharing. This is a requirement of the TRISH cooperative agreement with NASA. This cost share can come in many forms that must come from a non-federal source. So this can include salaries and benefits, value in additional % effort contributed by the PI, equipment purchases, supplies, travel, tuition fees, and indirect costs. So the value of volunteer services to the project. Cost share is at minimum 10% for every project. And this is usually not a very difficult thing for projects to find the cost share documentation for this effort. All right, and I'm going to turn it over to Dr. Vigneault to tell us about dual anonymous peer review.
Thank you. So as Dr. Bogari said, my name is Guillaume Vigneault, and I'm supporting TRISH with this EXPAND solicitation. And today I will briefly talk to you about the proposals review, and especially the dual anonymous peer review, which we call DAPR approach. So for 2 years now, NASA has implemented DAPR, and this is the first time TRISH is using it. So we want to give you the key information to best prepare your proposals. DAPR applies to both Step 1 and Step 2's proposals. And while information in this presentation will be mostly related to Step 2's proposals, it's a good opportunity to get your feet wet. Next slide, please. So DAPR, the key goal of peer review is to level the playing field for everyone. So we understand that it's difficult to completely interrupt biases through training alone, and it requires structural changes. And DAPR aims to create a change in the tenor of discussions away from the individuals on the proposing team and towards the proposed science. Next slide, please. So we perfectly understand that DAPR is not completely a blind process. While you will prepare your proposal, your Step 2 proposals, you will be asked to upload 2 different documents. First, an anonymized proposal, and also a not anonymized file, which is called the expertise and resources document. The merit of the proposal will be assessed anonymously and will be determined separately from the not anonymized qualifications of the team. Nevertheless, the qualification, track record, and access to unique facilities will form part of the evaluation. Next slide, please. So to submit your proposal in a DAPR compliant way, please exclude names and affiliation of the proposing team, including in figures and references to personal websites. In the proposal, text, use only numeric references like bracket and a number instead of referencing as name et al. plus the year. In your list of references, after your proposal, you will be, of course, more than welcome to use the usual reference format like you will do for any scientific article, for example. But in the text of the proposal, only use bracket number. Also, do not claim ownership of past work. So instead of saying my previously funded work, please say something along the lines of our analysis shown in whatever. Cited references in the passive third person, like prior analysis, indicates that XYZ. Also, do describe the work proposed. For example, it says we propose to do the following, or we will measure the effects of something. And also include a separate non-anonymized expertise and resources document, as I mentioned before. Next slide. So in some rare occasions, you may need to reference to unpublished work or proprietary results. And how would you do that? We understand that this will be needed in some occasions where, for example, you will have to cite exclusive access to datasets, non-public software or unpublished data or findings that have yet to be presented in public before but are not citable. Each of these may reveal or strongly imply the investigator on the proposal. So in these instances, proposals must choose language such as obtained in private communication or from private communication when referring to such potentially indicative work. Please just remember that the goal of DAPR is to shift the tenor to the discussion, not to make it absolutely impossible to guess the team members. Next slide, please. During the review process, your proposal will be evaluated through two phases. The first one will be the science review. So each proposal PDF will be assessed based on the merit criteria that you can find in the solicitation, which are robustness of the outlined scientific plan, the innovation, the approach, and the statistical plan for a topic one only. And the second review of the proposal will be regarding the expertise and resources review. So after the science review has been done, panelists will look at your expertise and resources document and will qualify the proposal team as qualified or unqualified. And just note that expertise and resources review phase may not be used by the panel to reevaluate proposals or to change the assigned adjectival grade. Sorry. Next slide, please. TRISH understands that DAPR may not be flawless, but we are observing and analyzing other programs as they adopt and adapt to DAPR approach to peer review. And formal support in Inspires is implemented but still new. So DAPR represents a major shift in the evaluation of proposals, and as such, there may be occasional slips in writing anonymized proposals. However, TRISH reserves the right to return without review proposals that are particularly egregious in terms of the identification of the proposing team. So please, when you write your proposal, make sure to follow the DAPR guidelines, and to help you with this task, you can find a DAPR guidelines for proposals document posted alongside the TRISH NOFO in Inspires. TRISH further acknowledges that some proposed work may be so specialized that despite attempts to anonymize the proposal, the identities of the principal investigator and the team members are readily discernible. As long as the guidelines are followed, TRISH will not return this proposal without review. So again, just make sure you follow the DAPR guidelines and you will be safe. And we implemented DAPR because it has a promise in increasing the focus of the science during reviews and reducing bias. And that's all for me. Thank you.
Thank you so much, Guillaume. So I'm including here just some connection information for Trish if you want to get connected with Trish. The email that I mentioned, spacehealth-info@bcm.edu, that's where you send questions if you haven't gotten an answer yet, or if you're looking for an answer to a question that's not talked about here. And I think we can open for questions, but I'll leave this slide up for a little bit in case folks need to use one of the QR codes.
Thank you, Rihanna. So I'll go ahead and go to the second question on the list and we'll come back to the first one. This one is going to be for Jimmy. What is up mass?
Yeah, up mass is the mass that's allowable on the spacecraft to go up, basically launch from Earth into space. So that's what we call up mass. And then the converse of that would be down mass, the amount of mass that comes back from space back to Earth. And so hopefully that helps you understand that definition.
Okay, thank you. And another question for you, Jimmy. How often are the essential measures collected?
Well, they're made available to each mission, the participants of each mission. So it really depends on whether they consent to it, right? So we're obviously bounded by that. But the availability of the science is made available to every participant. That's a part of our agreement with working with the launch providers.
Okay, thank you. And Rihanna, to what extent can we work with other NASA departments like the HHP lab?
You're more than welcome to work with other departments at NASA. That will not be something, that would be something that the PI would need to coordinate with on their own as part of the proposal. So no problem with working with NASA labs.
Thank you. And this can go to either Jimmy or Rihanna. Would in-flight free flyer only allow for a small device to be tested?
In-flight free flyer only would allow for hardware to be tested. Yes, that if hardware is just being tested, that sounds to me like it's a little more of a technology demonstration, but you know, depending upon whether there's a hypothesis-driven question being asked, that would be, you know, topic 1 or topic 2.
Okay. Okay, back to you, Rihanna. Will testing the shelf life of a space food product fit within this solicitation?
So we can't comment on the specific competitiveness of a proposal, but for food shelf life that's an interesting question. It's important to consider the time that these flights are actually going for. So like I said, these are for orbital missions, these are only about 3 to 5 days. And for PAM missions, these are about 10 days. And so it would be important to justify whether that would be sufficient time to collect useful data. But otherwise, we can't really comment on the competitiveness of a project idea. And make sure that it fits into the topic of one of the subtopics. So anything that's not fitting into a subtopic is not compliant with the solicitation.
Thank you. For topic 1, biomarkers, how critical is it that the biomarker analysis is continuous? If I would like to propose a novel method of analyzing biomarkers, but it is not continuous, would it still best fit under topic 1, biomarkers? This is for you, Rihanna.
Yes, that's a good question. Exactly continuous is not a stringent requirement. If it is, you know, measured multiple times or measured at multiple time points, that would be fine as well. The example that we gave is a continuous glucose monitor, just because that's kind of a well-known topic, but that doesn't need to be a continuous measurement. We just expect that it be more unobtrusive, so not that you not necessarily requiring something like a phlebotomist in spaceflight.
Thank you. This is for you, Jimmy. Is there room in the EXPAND program to fund projects for groups with access to commercial astronauts outside of TRISH?
There could be unique opportunities for that. I think the caveat here is going to be, should your project be awarded and you become part of the EXPAND program, you will be under a IRB governance associated with our cohort of EXPAND PIs. And so you would have to work out within your home institution's IRB how to do a reliance agreement with Baylor IRB to do the EXPAND IRB protocol. And then your separate protocol to look at your commercial astronauts outside of TRISH, outside of EXPAND, again, I think you would have to work out the details of with your home institution IRB how that would work. So, without, I guess, more details, it's really hard to provide a specific answer on this. But I hope that the understanding of how we have set up our IRB protocols with EXPAND will help at least understand that it is possible, but I think there's nuances in the details that we would have to understand how your current study is set up.
Okay, thank you. How does biosample collection work for flight definition phase and flight implementation phases? That can go to Rihanna or Jimmy.
Oh, could you repeat the very beginning of the question? How does biosample?
Yes, how does biosample collection work for flight definition phase and flight implementation phases?
That's a great question. Biosample collection. So if you were looking at biosample collection on the participants, that would be part of the flight implementation phase. Flight definition phase would be prior to activity in data collection. So data collection would happen after a mission is defined, which, so you couldn't be able to do data collection until a mission is actually defined.
Thank you. And this is for either Jimmy or Rihanna. Will this funding be secure considering some issues with the research climate and issues with federal funding agencies?
Yeah, I can take that. So yes, funding is secure for this solicitation. TRISH does continue to follow NASA's guidance in terms of the response to federal requests. We cannot speculate on future federal government budget conversations, but for now, this funding is secure for this project. So,
thank you. Must proposers use data collected in future flights in the proposed project, or the proposers can use the existing data collected from the crew members in the past? If yes, then are these existing data set available during the proposal development stage?
do you want me to take that one, Jimmy?
Sure.
So, there are existing data that are currently being collected, and they're stored in the EXPAND database. The EXPAND database is not yet openly available for requests, and it will be openly available it will definitely be openly available after the close of this proposal. So, or this proposal submission. So not in the development of the proposal, you would not be able to access that data. However, we expect the database to be available for inquiry sometime in late 2025. So it's possible that you may be able to have access to that data by request at a later date. Anything you want to add to that, Jim?
Yeah, if you are looking for pre-existing data, you're likely going to have to use a existing data set that you either have yourself or that's publicly available. To Dr. Bakari's point, we are not at a position where we are able to share data within the current data within the EXPAND database. So you will have to have a data source from an alternative location.
Okay, thank you. The next question is for Brianna. It's in reference to topic 1, subtopic VR medical training. For the just-in-time training, when mentioning just-in-time, is the solicitation looking for VR training in flight, free flyer only, or pre and post flight? Does this include AR if in flight? Could you expand on the expectation for this medical training? What bucket on the research menu approach does this subtopic fit in? And I can reread some of those questions if you want to tackle the first few.
Thanks. So to your point, it could be pre-post training, or it could be in flight. In flight would again only be an orbital mission. It can be medical training for any kind of medical need. We're not being specific here, so but obviously justify the choices of medical training thing. In terms of AR and VR, these are VR. We believe that this will be a VR headset, and I'll turn it over to Jimmy to explain whether there's any the nuance there.
Yeah, so this any proposals in this topic area will have to be contingent on the hardware that is provided by a particular launch provider, given the mission. So this is why we've separated into flight definition versus flight implementation phases. We need to understand from your proposal as you develop and define the project, what platforms do you need? If it can only be AR or can it be VR? Those are the aspects of your proposal we need to understand, so that as we work with the launch providers and as they mature whatever extended reality platform they want to take into space, then it becomes the opportunity for us to integrate with the launch provider so that your training project software would be deployable on that platform. And so there is some contingency there. There are some conditions there. And so we don't have those details. So that's why it's kind of loosely written like that. But hopefully that helps you with understanding how to best bring a good proposal forward with regards to how you want to test your particular training software.
And it's worth just adding another note to that is that we know what tool is likely to be available for some flights, but future flights may use a different tool and there might be a change in the tool. And so we recommend interoperability wherever possible. And that's noted in the solicitation because tools change, but if it's a software, the more tools it can apply to, the better. Nicole, is there anything we missed from that question? I know it was long.
So the last piece of that one was what bucket on the research menu approach does this subtopic fit in? And that would be for you, Jimmy.
So in this case, it would be it could be either one, right? If you have a hypothesis-driven approach to do just-in-time medical training that hasn't been done before, that we would consider that, expeditionary. However, if you already have an approach that's been well tested and validated on Earth for just-in-time training, but you're looking to try to optimize it or deploy it on said future extended reality platform, that would be in the benchmarking. So there's depending on the nature of the study you're looking at. So we're in this particular topic, we're looking to how do we provide just-in-time training. And so you may have a conventional proven approach, but we need to optimize it. Or you may have I've got a great idea of doing training now. It's going to use this as its presentation format, but I need to validate it, or it needs to be validated further, and I want to optimize it for spaceflight. So those it could be in either bucket.
Okay, thank you. And we had another VR question, so I'll go to that one. If working with VR, is there any way to find out if VR equipment will already be available in flight, or will we have to specify it as additional hardware?
Yeah, so I think Dr. Bakari alluded to this earlier. We have a notion of what the launch providers will do, but it hasn't been finalized yet. And so as Dr. Bakari had mentioned, it is conditional. However, we suggest in your proposal an approach that allows it to be agnostic of the specific hardware platform. So if you can go on multiple hardware platforms, that would be advantageous to you of your proposal.
Thank you. This next question is for Guillaume. Is expertise and resources part of step 1 or only step 2?
Expertise and resources will be only part of your step 2 proposals.
Okay, thank you. Okay, next question. Can NASA's HHP lab act as our research partner on this project? Rihanna.
That would be absolutely fine. No problems with NASA personnel being partners or being PIs. As a matter of fact, in Mr. Wu's slides, you saw that there is a NASA PI, a NASA JSC PI on one of our funded essential measures projects. So that's perfectly acceptable.
Thank you. If a project is flight ready for a tech demo, are any researchers needed?
You want to take that one, Jimmy?
Yeah, we would still need researchers as the authority to the project lead, essentially, to be able to address the various requirements of receiving grant funding, federal grant funding. So Yeah, so I mean, we just need, there still would be expected to be a report on the progress and development and performance of the tech demonstration. So as such, it's a researcher in the sense that there's still a authority that is responsible for the execution of the grant itself.
Just to add to that, so if this was from a company, for instance, and you're, someone in the company would need to be the principal investigator. And yes, they don't have to be asking hypotheses if it's just a technology demonstration, but we still need that touch point.
Okay, thank you. And this is a part 2 to that question. If a tech demo addresses several flight risks from the risk roadmap, would a proposal be required for each study to address each risk individually?
No, those could all be rolled into one proposal.
Next question, can the flight definition phase include funding for Earth-based studies to prepare for the research test on the flight itself?
So that is allowed, but I will caveat the fact that the shorter the flight definition phase, the more likely it is to be able to get on a flight. So the longer the flight implementation phase, the better. And I will note that it is stated in the solicitation that significant preliminary data is required for both topics. So, if there are some small amount of studies needed, of course, that is doable but it will be reviewed in that way. So keep that in mind.
Okay, thank you. And is there a separate mechanism for gathering preliminary Earth-based data?
Not a part of this solicitation. There is not a separate mechanism for gathering preliminary Earth-based data.
Okay. And if your technology needs optimization, would that be in the flight definition phase?
You want to answer that one, Jimmy?
Right, yeah, no, it would be it would be actually part of your flight definition phase. We would want at the finish of your flight definition phase that your technology would already be ready for space flight. It would be a turnkey solution to be delivered to the launch provider.
Okay, thank you. And we have a duplicate question. Someone had to log off, but they wanted to know, does the biomarker analysis have to be continuous? If you don't mind repeating the answer to that question.
Sure. The biomarker analysis does not need to be continuous. Preferred that there are multiple queries over time, but continuous was just an example from a continuous glucose monitor.
Okay, thank you. And those are all of the questions at this time.
Thank you so much. And do you want to close this out, Jimmy?
Sure. Well, thank you everyone for taking the time to join our pre-proposal webinar. I hope this is a very exciting request for proposals with regards to our new EXPAND program to support science on commercial spaceflight missions. As mentioned earlier, we still have the slide deck up in terms of how to reach out to us. The recording of this webinar will be made available, as well as the slide deck. So if you have any additional questions, reach out to us through the TRISH concierge system, and we will be able to get any additional questions addressed that way.